My hope is that Facebook, instead of taking it personally that somehow I'm saying Facebook is killing people, that they would do something about the misinformation, outrageous misinformation about the vaccine.
His view is clearly that the social media companies are not doing enough to amplify the truth about the disease and steps we take to fight it. Hi, I'm Joanne Kennan. I'm the editor-at-large for healthcare at POLITICO, and I'm talking to you about misinformation and the coronavirus.
99.5% of the deaths in the United States are among unvaccinated people. Boy, if there ever was a statistic that would stimulate someone to get vaccinated, I think this one is it.
This is really an outbreak of the unvaccinated. We're now getting more than 50,000 new cases diagnosed a day. As the Delta variant spreads through the country, the bottom line is if you were fully vaccinated, you still have pretty good protection. In fact, very good protection against serious disease and death. I think it's important to understand that this misinformation is out there. There was a study showing that an awful lot of the misinformation comes from just 12 people with huge followings. And when people make decisions about vaccination that you might disagree with, they're getting information from people they trust. They think they're making the smart and healthy decision. There's misinformation about fertility. There's misinformation that it changes your DNA. So rather than blaming the people who choose not to be vaccinated, we have to do better at figuring out how to cut through the misinformation and create trust in the accurate information.
Something has changed, and what has changed is the virus. The CDC hasn't changed, and the CDC hasn't really flip-flopped at all.
The changing advice on masks has been confusing to the public and has fueled a lot of the antagonism. The CDC said time to mask up again in parts of the country where there's significant transmission, and the part of the country that has significant or substantial transmission is growing daily. We may see more mandates as this spreads.
More and more places starting to roll out mandates, including the VA, the first federal agency to do so. California, New York City, the Mayo Clinic, for example. You've got President Biden considering one for all federal workers.
Vaccine mandates are really unpopular. We are a country that doesn't like to be told what to do. And the people who have not voluntarily gotten vaccinated, despite all the incentives and opportunities, they're really not going to want to be told they have to have one. It has been declared legal. A business can say you cannot work in this office. You cannot come to this sporting event. You cannot come into this theater. Those kind of mandates, I think we will see more and more of them. One of the many fears is that it's too new, it's too experimental. The FDA has authorized it for emergency use. The FDA has not yet given it sort of normal approval, and it's probably going to be at least a few more months before younger kids can get the vaccine. So I think we're going to see a lot of controversy about masking in schools. And there can be friction between a town or school system that wants mandates and a state government that doesn't want them.
But it's time to start blaming the unvaccinated folks, not the regular folks. It's the unvaccinated folks that are letting us down.
I think there's two reasons why some of these conservative voices are now more pro-vaccine. One is this Delta variant is spreading so rapidly, and we're seeing the numbers move in the wrong direction. And I also think that some people who were nervous about it, they now know friends and relatives and co-workers or public figures who've had it and didn't drop dead. President Biden and his administration really want to double down on pushing back against Delta before it gets an even bigger foothold than it already has.
Now we need to go to community by community, neighborhood by neighborhood, and oftentimes door to door, literally knocking on doors to get help to the remaining people protected from the virus.
There's this balance of if you come on too strong, you have to let the local public health people really set the tone. There's going to be greater trust with local officials, local politicians, local newscasters, etc. It's really complicated with multiple strands of distrust and antagonism.